So one of the hardest conversations I've had, or I always have to have as a home care agency owner, as well as a home care agency nurse, is with families who aren't ready to hear how sick their loved one is. And I'm sure most of us, would never be ready, or it's difficult to be ready to hear how sick your loved one is. And I do understand why. No one wants to hear that somebody they love is declining in health. So the story goes like this. I do walk into a home and a family member will be saying something like, they're just a little weak and they'll definitely bounce back. They just need a few more weeks to feel better. But you as a nurse, you're trained to see all the small changes and kind of know what is going on, what is happening with these changes. You're seeing the weight loss. You're seeing an increase in confusion. You're seeing weakness. These things are telling you a story. They're telling you that the body is struggling. And sometimes we are standing in somebody's living room and trying to figure out how to say something that will break their heart. So my conversation will start with something like, very gently, and I'll say, tell me what changes you've noticed recently, towards the family member. And then I'll explain what I'm seeing as a nurse, okay? Not to scare them, just to bring them home and let them understand what I am saying. This is not to take away hope. This is just to help them get prepared. This is mostly something that I encountered when I did hospice, okay? And also I do see it in home care where you see this patient is hospice appropriate, but the family is not ready. So because when families understand what's happening, they can spend more time and focus on what matters most, right? They want to be present. They want to be together at this time. The hardest truth in healthcare is this. Sometimes love makes it hard to see what is right in front of us because we always want the best for our loved ones, right? And when a nurse has these conversations with family members, it's not because we are giving up on this individual. It's because we care enough and we want to be honest. And sometimes honesty is hard. But if you are here to have those hard conversations with a family member, you know how heavy it can be. And being honest to them could help them be able to transition and see what's going on with their loved one. So if you're a nurse, either in home health, or even in hospice, or even in the hospital sometimes, or even in the nursing home, right? What conversation did you have? What hard conversation did you have to have with the family just to bring them to understand, to see the changes and decline in their loved one, and to make them understand that there's nothing wrong they did,